Occupational English Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for Extract 1.
Extract 1. Questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
All right, my name is Erica and I'm one of the physiotherapists here.
Hi, Erica.
How can I help you today?
I've been getting a pain in my lower back on the left side, around my hip and through the bum cheek area, when I'm running especially.
Okay, that's not sounding terribly comfortable at all. How long has this been going on for?
It's something I've had on and off for years, and it started off as just a kind of dull pain, a bit of an ache, and now it really feels like it's spasming or something. It hurts even when I put weight on my left leg. Usually I feel it start, and if I kind of lie on a tennis ball and massage through the muscle, it goes away. But lately it's just been getting worse, and I can feel it sort of tight through my whole hip area. And I can feel it kind of even when I'm sitting and sleeping, or at night when I'm trying to sleep. If I roll, I can feel it kind of, it's hard to explain. It's like a shooting pain that travels down my leg.
Okay, so you described the pain initially as a dull pain,
Yeah,
and also an aching sort of a sensation.
Yep.
Is the shooting pain different to that?
Yep.
Okay, so the shooting pain, where does that go?
It starts in the same place, and it goes like down the back of my leg, kind of through the back of my knee, and sometimes down to my ankle area.
Okay, no worries at all. And that would be the shooting pain only? That's not an aching sensation?
No, it's just like, it feels like a twinge travelling down.
All right, so just coming back to our body chart for a second. So we've talked about 2 distinct pains, I think. There's that dull aching pain sort of around the bum and the lower back and the hip area there. Then there's that shooting pain or twinging pain that you get that goes right down the back of the left leg down to the calf.
Yep.
With the twinging pain, do you have to have the dull pain in your bum before you get the twinging pain?
Yep.
You have to have that pain
Yep.
first. Okay. Can you ever get the twinging pain by itself?
No.
No. Okay. Can you get the dull pain by itself?
Yeah.
Yes. Okay. So you have to have one to get 2.
Yeah, I don't always get the twinging pain. That's usually when it's feeling worse. It gets really tight.
Okay, no worries at all. Now, just to confirm and clear some other areas, there's no current problems with your left knee?
Nope.
Beautiful. And currently the front of the left hip is fine?
Yeah, it feels quite tight through there, but it's not painful.
So tightness?
Yep.
No worries at all. Any pains in the right hip?
Nope.
No. The right knee?
No, the right side's fine.
Completely fine.
Yeah.
Good. No pains at all down there?
No.
Any pins and needles or numbness anywhere?
Nope.
No. Good.
Extract 2, questions 13 to 24. You will hear a local GP talking to a patient. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Paul. How are you doing today?
Oh, hello, Doctor.
Well, I see that you've just had heart surgery for a repair of an aortic aneurysm and now have a mechanical heart valve in place.
Yes, my surgeon advised me that I set up contact with a local GP for follow-up care, so here I am.
Yes, your thoracic surgeon, Dr. Goodhands, has forwarded me your case history, but it appears you've made a very good recovery.
Well, I hope so.
Now, before we talk more about managing your recovery, I'd like to get a few personal details from you, if you don't mind.
Okay.
So, how old are you?
32.
And where are you from?
I'm from China.
Okay, and are you married?
No, I'm single.
And where are you living now? House or apartment?
I'm sharing a house with some other students.
Okay, and what are you studying?
I'm doing a PhD in IT.
So you're quite busy here in Australia.
Yeah, that's right.
And how is your study going?
Okay, I'm enjoying it, but it's pretty intense.
So a bit of a stress involved with your study?
Yes.
I see. Now a bit of information about your medical history.
Okay.
Do you suffer from any allergies?
No.
Any past surgical history?
I had my tonsils removed as a boy.
And apart from that?
No.
How about your blood pressure?
It's been high since 2009.
Is there any family history of illness?
Well, my father died of a stroke when he was 45.
I see. Do you drink?
Not much. Sometimes on the weekends.
What about smoking?
Not now, but I used to smoke about 10 to 15 cigarettes a day.
And what's your current weight?
95 kgs.
And your height?
I think I'm about 178 centimetres.
When was your operation exactly?
2 weeks ago, the 2nd of September actually.
Okay, let me check your blood pressure. Good news. It's 110/70.
Oh, good.
Pretty soon we'll be able to start weaning you off some of the blood pressure lowering medication.
Well, that'd be good.
And how is your diet at the moment? Are you being careful with what you eat?
Yes, I've managed to reduce salt in my diet and I'm trying to lose some weight.
Good. And are you doing any exercise?
No, I'm afraid to do anything too much at the moment.
Okay, I understand. But you could now start with some gentle walking or other forms of mild exercise. Just be sure you don't lift heavy weights.
Right.
And there is a very good cardiac exercise program that I'd advise you to join. It's run by the Cardiac Rehabilitation Unit at the Spirit Hospital. So I'd recommend you contact them.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Now read the question.
Question 25. You hear part of a talk on a medical condition. Now read the question.
Autonomic dysfunction can be caused by a myriad of the following factors, and more than one can concur even in the same patient. Degenerative neurologic diseases such as Parkinson's disease, multiple system atrophy, and pure autonomic failure presenting or suffering from orthostatic hypertension and fixed heart rate responses, etc. An immune-mediated attack, either idiopathic or paraneoplastic, can be a source of focal or generalized autonomic dysfunction, as in Guillain-Barré syndrome or in autoimmune autonomic ganglionopathy. Metabolic and toxic damage, as in diabetes mellitus, amyloidosis, and Fabry disease. Genetic disorders, like in dopamine beta hydroxylase deficiency and familial dysautonomia. Abnormal reflex responses in carotid sinus hypersensitivity, vasovagal syncope, and other neuromediated syncopes, and probably in postural tachycardia syndrome, POTS. Abnormal sweating responses, as in generalized or focal hyperhidrosis, related to an excessive activation. Traumatic or tumoral spinal cord injuries at different levels and presenting with the so-called autonomic dysreflexia.
Question 26. You hear a plastic surgeon talking about aging. Now read the question.
Aging is characteristic to all living organisms, and humans often regard it with some level of fear and trepidation. The thought of losing smooth, clear, and bright skin in exchange for folds and wrinkles seems enough to put a damper on many a spirit. The good news is, a number of anti-aging procedures can be effective in ridding your skin of dullness and excess pigmentation as you grow older. When the process is completed by a certified surgeon, skin procedures such as lasers, chemical peels, facelifts, microdermabrasion, and several others can be used to improve the quality of your skin and combat the effects of aging.
Question 27. You hear a nurse talking to a patient about eczema. Now read the question.
Yeah, I've brought my son in, and he has been scratching and has eczema on his hands and his arms, and it's been going on for a while now. I just don't know. I don't know what to do.
Oh, so I mean, have you been before previously? Have you got any information on the eczema or?
Not really, no. I thought it would go away. I thought it would be something that's just a childhood thing, or just a temporary thing, and it would grow out of it. But
well, I mean, some people certainly it can seem like they grow out of it because it might be something they've suffered with as a child, and then could be a multitude of of reasons why they don't have it as an adult. They could just grow out of it. It could be that you're using specific products, washing powder. It could be something that is aggravating the eczema.
Okay.
Then as people grow up, they tend to change their routine and it doesn't affect it anymore. You know, certain soaps could be irritating that.
What about people have told me food allergies can be a thing? I mean, I probably think that might make sense because he's just started eating solid foods and things like that. So
I mean, certainly people can have allergies towards a certain food. With regards to causing or aggravating eczema,
yes.
Something that you could look into further. But I personally don't think there's going to be anything that's going to be massively contributing to that.
Okay.
Question 28. You hear discussion of a news article. Now read the question.
Well, this can't be right. Monkeypox?
What's that?
This article says that it's rare disease caused by the monkeypox virus. It usually originates in Central and West African countries, but there's been 2 cases in the UK so far. The article says that it spreads after close contact with infected people, and that the symptoms are usually fever, headache, muscle ache, backache, chills, fatigue, and swollen lymph nodes. Plus, a rash can develop that covers the sufferer's face and other parts of the body. It looks like they've contained the disease in the UK, and the 2 people who've got the disease aren't linked to one another, but both of them have recently been on trips to West Africa. Thankfully, transmission from infected people to the general population is extremely unlikely, and the 2 patients are getting the best care from some of the best tropical disease specialists in the world.
Question 29. You hear discussions of a news report. Now read the question.
This news article has to be a joke. A local school that asks parents to respect the rights of others who do not want to vaccinate their children is now struggling to manage a severe chickenpox outbreak. An estimated 80 pupils have been diagnosed with the infectious disease within the last fortnight after the condition was contracted by an unvaccinated 9-year-old student. Those with the condition make up a quarter of the entire school, whose records showed that only 73.2% of pupils had been vaccinated against chickenpox, compared with a national figure of 92.1%. I can't believe this could happen, considering the fact that the government in Victoria have introduced the no jab, no play policy. That was supposed to mean that all children enrolling in preschools and nurseries had to have up-to-date vaccinations or pre-approved exemption. They really should have made it mandatory for primary and secondary schools too.
Question 30. You hear part of a GP consultation. Now read the question.
Hello, my name is Stephen Williamson, one of the doctors here, and you must be Mike. What brings you here to see me today, young man?
I fell off my bike, sir.
Oh, ouch. Is that how you've ended up with that nasty gash there?
Yes. I think I was going too fast. I was trying to make my bike go up on one wheel and I lost control. My mom says I'll have a scar for the rest of my life.
Well, not necessarily the rest of your life, but you will be able to see something there until it fades. I'm going to stitch that up for you to stop the bleeding and so you don't get an infection, okay?
Will it hurt?
No, first I'll clean and numb the area and I'll give you a local anaesthetic. You may feel a little tug during the procedure, but it's more irritating than painful. I'll also book you in an appointment to come back in 7 to 14 days to have them removed. It would have healed by then.
Thank you.
That's okay. In the meantime, I need you to keep the wound bandaged and dry at least for the first day, and you'll need to wash around the wound with clean water at least twice a day. I'll prescribe you with some jelly rub to put on it too.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36.
You hear a doctor, Courtney Stanton, delivering a presentation on atherosclerosis. You now have 90 seconds to read questions 31 to 36.
Hello everyone, my name is Dr. Courtney Stanton, and today we're going to discuss atherosclerosis. This is a disease in which plaque builds up inside your arteries, the blood vessels that carry oxygen-rich blood to your heart and other parts of your body. Plaque is made up of fat, cholesterol, calcium, and other substances found in the blood. Over time, plaque hardens and narrows your arteries. This limits the flow of oxygen-rich blood to your organs and other parts of your body. Atherosclerosis can lead to serious problems including heart attack, stroke, or even death. The exact cause of the condition isn't known, however studies show that it is a slow, complex disease that may start in childhood. It develops faster as you age. Atherosclerosis may start when certain lifestyle factors damage the inner layers of the arteries. These factors include smoking, high amounts of certain fats and cholesterol in the blood, high blood pressure, high amounts of sugar in the blood due to insulin resistance or diabetes. Plaque may begin to build up where the arteries are damaged. Over time, plaque hardens and narrows the arteries. Eventually, an area of plaque can rupture or break open. When this happens, blood cell fragments, called platelets, stick to the site of the injury. They may clump together to form blood clots. Clots narrow the arteries even more, limiting the flow of oxygen-rich blood to your body. Depending on which arteries are affected, blood clots can worsen angina, chest pain, or worse, cause a heart attack or stroke. Researchers continue to look for the causes of atherosclerosis, and they hope to find the answers to such questions as why and how the arteries become damaged, how plaque develops and changes over time, why plaque ruptures and leads to blood clots. They are particularly aware that there are certain risk factors. In fact, many factors place you at risk of atherosclerosis. Some of these risks can be prevented, whilst others cannot. The first risk factor is family history. If atherosclerosis runs in a person's family, then they may be at risk of hardening of the arteries. This condition, as well as other heart-related problems, may be inherited. Lack of exercise. Regular exercise is good for the heart. It keeps the muscles strong and encourages oxygen and blood flow throughout the body. Living a sedentary lifestyle increases your risk of a host of medical conditions, including heart disease. A third risk factor is high blood pressure, which can damage blood vessels by making them weak in some areas. Cholesterol and other substances in the blood may reduce the flexibility of arteries over time. A fourth risk factor is smoking. Smoking tobacco products can damage blood vessels and other areas of the heart. The final risk factor that I'll highlight today is diabetes. People with diabetes tend to have a much higher incidence of coronary artery disease. Most symptoms of atherosclerosis aren't noticeable until a blockage occurs. Common symptoms include chest pain or angina, pain in the leg, arm, and anywhere else that has a blocked artery, shortness of breath, fatigue, confusion, which occurs if the blockage affects the circulation to the brain, and muscle weakness in the legs from lack of circulation. Once a blockage occurs, it's generally there to stay. With medication and lifestyle changes, though, plaque may slow or stop growing. They may even shrink slightly with aggressive treatment. Treatment options include lifestyle changes. Reducing risk factors that lead to atherosclerosis will stop or slow the process. That means a healthy diet, exercise, and no smoking. These changes won't remove blockages, but they are proven to lower the risk of heart attacks and stroke. Medication. Taking drugs for high cholesterol and high blood pressure will slow and may even halt atherosclerosis. They could also lower the risk of heart attack and stroke. Doctors can use invasive techniques to open up blockages from atherosclerosis or go around them. Stenting. Using a thin tube inserted into an artery in the arm or the leg, doctors can get to diseased arteries. Blockages are visible on a live X-ray screen. Angioplasty and stenting can often open up a blocked artery. Stenting helps to reduce the symptoms, although it does not prevent future heart attacks. Bypass surgery. Surgeons harvest a healthy blood vessel, often from the leg or the chest. They use the healthy vessel to go around the blocked segment. These procedures can have complications. They're usually safe for people with significant symptoms or limitations caused by atherosclerosis.
Extract 2, questions 37 to 42. You hear an interview with Dr. Craig Harrisberg talking about avoidant personality disorder. You now have 90 seconds to read questions 37 to 42.
My name is Dr. Craig Harrisberg, and I'm a mental health professional specializing in psychiatric well-being. My topic today is personality disorders. People with avoidant personality disorder, or APD, have a lifelong pattern of extreme shyness. They also feel inadequate and are hypersensitive to rejection. APD can cause psychiatric symptoms that create serious problems with relationships and work. If you have APD, you might have difficulty interacting in social and work settings. This is because you may fear any of the following: rejection, disapproval, embarrassment, criticism, getting to know new people, intimate relationships, and ridicule. You may also have trouble believing that people like you. When you're sensitive to rejection and criticism, you may misinterpret neutral comments or actions as negative ones. Researchers today don't know what causes avoidant personality disorder, though there are many theories, however, about possible causes. Most professionals subscribe to a biopsychosocial model of causation. That is, The causes are likely due to biological and genetic factors, social factors, such as how a person interacts in their early development with their family and friends and other children, and psychological factors, the individual's personality and temperament, shaped by their environment and learned coping skills to deal with stress. This suggests that no single factor is responsible. Rather, it is the complex and likely intertwined nature of all three factors that are important. If a person has this personality disorder, research suggests that there is a slightly increased risk for this disorder to be passed down to their children. There is no way to know who will develop APD. People who have the disorder are typically very shy as children. However, not every child who is shy goes on to develop the disorder. Likewise, not every adult who is shy has the disorder. If you have APD, your shyness most likely grew as you got older. It may have gotten to the point that you began avoiding other people and certain situations. Your doctor may refer you to a mental health professional who will ask you questions to determine if you have APD. To be diagnosed with APD, your symptoms must begin no later than early adulthood. You must also show at least 4 of the following characteristics. You avoid work activities that involve contact with others. This is due to fear of criticism, disapproval, or rejection. You're unwilling to get involved with other people unless you're sure they will like you. You hold back in relationships because you're afraid you'll be ridiculed or humiliated. The fear of being criticized or rejected in social situations dominates your thoughts. You hold back or completely avoid social situations because you feel inadequate. You think you're inferior to others, unappealing, and inept. You're unlikely to take part in new activities or to take personal risks because you're afraid of embarrassment. Psychotherapy is the most effective treatment for APD. Your therapist may use psychodynamic psychotherapy or cognitive behavioral therapy. The goal of therapy is to help you identify your unconscious beliefs about yourself and how others see you. It also aims to help you function better socially and at work. Psychodynamic psychotherapy. Psychodynamic therapy is a form of talk therapy. It helps you become aware of your unconscious thoughts. It can help you understand how past experiences influence your current behavior. This allows you to examine and resolve past emotional pains and conflicts. Then you can move forward with a healthier outlook about yourself and how others see you. Psychodynamic psychotherapy produces lasting results with benefits that continue after treatment. Cognitive behavioral therapy. Cognitive behavioral therapy, or CBT, is another form of talk therapy. In CBT, a therapist helps you recognize and replace unhealthy beliefs and thought processes. Your therapist will encourage you to examine and test your thoughts and beliefs to see if they have a factual basis. They'll also help you develop alternative, healthier thoughts. Medication. The FDA hasn't approved any medications to treat personality disorders. However, your doctor may prescribe antidepressant medications if you have co-occurring depression or anxiety. People who don't receive treatment for APD may isolate themselves. As a result, they may develop an additional psychiatric disorder, such as depression, agoraphobia, substance abuse problems. Treatment doesn't change your personality. You'll most likely always be shy and have some difficulty with social and work interactions. But treatment can improve your symptoms and help you develop the ability to relate to others.
That is the end of Part C. You now have 2 minutes to check your work.